Hello, this is Dr. Michael Gott. I'm an orthopedic surgeon at Westchester Health, Orthopedics and Sports Medicine. Today I want to talk to you a little bit about ankle sprains, as Calvin Johnson has been dealing with an ankle sprain throughout the entire season and aggravated it on week 8 in the NFL season. Now, ankle sprains come in all different types, and it's very difficult to prognosticate based on the limited amount of information they're giving us how long these players are going to be out or how much it's affecting them. There's different kinds of ankle sprains that you hear about. You hear about a high ankle sprain, or you also hear about just a regular ankle sprain. Now, when you hear about high ankle sprain, that's really a bigger injury because that involves the ligaments that attach the fibula to the tibia or the syndesmotic ligament. And sometimes those even require surgery. So if you hear the words high ankle sprain, you usually think about players being out for a significant period of time, at least 6 weeks, while they allow it to heal and maintain motion. Now, when you think about a lower ankle sprain or a normal ankle sprain, like in the instance of Calvin Johnson, it really depends upon how much motion he has and how strong the muscles that cross his ankle are to begin with. If he has any previous ankle instability, it could also be a factor as well. The key to the early treatment of these ankle sprains, however, is early rest, ice, elevation, and some anti-inflammatory medications. Now, the way we deal with it on the sideline in the game, sometimes you can even tape the ankle to get enough stability, but that's going to really limit the player like Calvin Johnson in his vertical and also horizontal movements. So, if you have him on your team and he's now week to week with an ankle sprain, I would probably be very optimistic that he's going to play. He'll be able to get taped, he'll be able to wear a brace, and most likely get through it. Now, if they start talking about a high ankle sprain, then that's a different story altogether, and I would probably look to add somebody else on your team or start somebody else in his place.